We'll go ahead and get started. Thanks everyone for joining us. I'm David Bottorff, Executive Director of the Association of Indiana Counties, and we had a couple counties contact us, really for the last several months, talking about healthcare and county hospital issues and how they're being affected by the pandemic. So we wanted to do this presentation and talk about some of those issues. And with us is Brian Tabor, and Brian serves as president of the Indiana Hospital Association, representing approximately 170 hospitals in Indiana, including all the county hospitals. Of course, as an association, they follow federal legislation, state legislation, regulatory uh, rules, and just really advocate on behalf of the hospitals in Indiana. Uh, Very influential at the state house, and Brian does a tremendous job representing the hospitals at the state house and at the federal level as well. He's a Purdue graduate. Um, and he actually undergrad was political science, and then master's in agricultural economics.
Yeah, work with Professor Larry DeBoer.
Yeah, Larry DeBoer. So I'm going to turn it over to Brian, and the first we want to talk. I want to thank him. Many of you know we did a radio commercial back in November and December, urging people to be careful during the holidays, wear their mask. You can still, get infected at the holiday events with family. And so they were a huge supporter of that commercial. So I want to thank him for helping us do that. And of course, hospital workers are really heroes right now, frontline workers, and they're doing a tremendous job trying to keep the community safe. So, Brian, thanks for being here. And really, how has the pandemic affected hospitals these past 10, 11 months?
Well, Dave, first of all, thank you for the opportunity. And I've got some slides that I'll share to just kind of walk quickly through what the pandemic uh, has meant for our hospitals and for healthcare in Indiana. If you want to bring those up, I'll walk through them. I do also want to thank you for the leadership, you and your members, with the commercials and the public messaging. It is very much appreciated, and we will certainly want to continue that partnership as we move into a time of encouraging Hoosiers to get vaccinated. And the state has a campaign right now. It's our shot, and we want to encourage everyone. So look forward to partnering with all of you in endeavors to educate people about the importance of vaccination and how we kind of turn the corner here and get back to normal. And just thank you for your long time partnership. We worked together for a long time, and thank you for everything you've taught me and assisted me with over the years. So, uh, as Dave said, our frontline workers are rightfully heralded as heroes, and I want to start just by acknowledging all of our county hospital healthcare workers, and the nurses, and these nurses are pictured here from not from a county hospital, they're from King's Daughters Hospital in Madison, Indiana. A picture that was taken early on during the pandemic. Lamar Advertising was kind enough to donate this billboard, which was around the state back in the spring. And our frontline healthcare workers are certainly the doctors and nurses, but there's so many more that work in your county hospitals and hospitals across the state. Environmental service workers that are coming in to clean and make spaces safe for all patients, whether they have COVID or not. They've worked just around the clock throughout this. And it's been really, really tiring, and that has had some impact on staffing, and I'll talk about that. There are 23 county or municipal hospitals in the state. That number has shrunk. There were about, I think, 35 county hospitals when I started in the Indiana Hospital Association about 10 years ago, a little more than 10 years ago. And some communities have made decisions where they have sought to partner with other organizations. But the state of county and municipal hospitals is still strong. Now, there's definitely some threats out there, financial impact of the pandemic and others. But we really are blessed to have these hospitals in our state, and they serve patients all the way up from Adams County in the top of the state down to Perry County in the bottom, and many, many places in between. Not just rural areas, of course. We have Eskenazi as part of Health and Hospital here, and then smaller cities throughout the state. And um, Logansport, Shelbyville, and Columbus. And then some are small rural facilities. They are county hospitals, but they're also what's called a critical access hospital. So they have a maximum of 25 beds. So all flavors of county hospitals. The financial impact has been severe. Now, I will say, and I will thank our congressional delegation for very quickly providing relief to hospitals in Indiana. Without their action, I frequently in the spring, when COVID was at its height and really care was shut down, understandably so, there was a shortage of PPE. We had to suspend pretty much everything except for taking care of COVID patients and the most severe injuries. That certainly hurt payment, it hurt revenue, and hospitals were hurting. And I really was concerned that we would have several hospitals, if not more, that would have difficulty meeting payroll by the 4th of July and that may not be able to keep their doors open through, let's say, Labor Day. But thankfully, with the support from Congress, that has helped to kind of stem the losses. Now, there are still some vulnerabilities, but this slide just shows you how steep it was. The average margins between March and April dipped into negative areas. And really, for the smaller hospitals, again, not all county hospitals are critical access hospitals, but you can see the impact on them, negative 27 plus percent reduction in their operating margin. They were really hit the hardest. And so that continued through the summer until, again, that federal relief was able to fill a bit of this gap. And then as we kind of moved out of the initial lockdown period and patients started to come back to the hospital, we saw emergency care come back somewhat. We saw some of those inpatient surgeries and outpatient surgeries, they came back. But the costs have really continued. We really are still seeing a lot of costs that were impacting hospitals. So county hospitals were hit with loss of revenue when we slowed down. We had to restrict care and also hit with higher costs. And many of those costs have continued. So the PPE, of course, at the height of the pandemic, the costs for personal protective equipment were exorbitant. We had heard stories of masks, gloves, and I'm sure some of your members as well, I mean, having to supply PPE to emergency workers and first responders. You know, we were paying 5, 7 times the normal. We heard that at some points it was as much as 10 times the normal price, especially for the more specialized equipment, small gloves and everything. That is better now, but the market's still not back to where it was. It's still higher than normal. Drug shortages, wage and labor, that is still something that is a huge issue that county hospitals are facing. To be able to recruit nurses to come in, our workforce is very tired. They've been heroes for months now around the clock. And so hospitals have needed to recruit in nurses from staffing companies, and that is very expensive. Normally not so expensive, but now incredibly expensive. And that continues today. That hasn't gone away. In fact, it's gone up. Other supplies, ventilators, hospitals have remade themselves. We've had to create new entrances to keep patients that may have COVID away from those that may have maybe immunocompromised coming for cancer treatments. We added ICU beds early on in the pandemic. So a lot of costs there. This all means that across the country, this is a nationally regarded firm that studies healthcare economics, Kaufman Hall. They projected just before the end of the year that 51% of hospitals, community hospitals in the U.S. would have a negative margin by the end of 2020. I can't give you an exact number for that for Indiana. It's too soon to know how that's settling out, but it will have an impact, and many hospitals, I think, are going to end with significant losses, even with that federal relief. And then just lastly, Dave, the pandemic has created some financial vulnerabilities for our hospitals. Many of our county hospitals, whether they're medium-sized or the smallest, as critical access hospitals, across the nation, there was already this underlying vulnerability, an epidemic of hospital closures. Another national group called Guidehouse looked at hospitals in Indiana. They published a report in April. 31% of Indiana hospitals they studied were at high risk of closure. Didn't mean they were going to close tomorrow, but they any shocks to the system essentially would be very problematic. And that was before the pandemic. I think everyone's holding on right now, but there is that underlying vulnerability. We lost one of the first community hospitals in some time, just last year, I guess it was 2019, when the hospital in Connorsville, Fayette Regional, closed. Fortunately, Reed Health was able to partner with them. But there were 18 hospital closures and 19 across the country. 21 hospitals closed in 2020. And we know that many more entered bankruptcy at the end of 2020. So I think 21 is going to be a record year for hospital closures. I hope that none of those will be in Indiana. I don't see any that worry me at the moment, but we're not out of the woods yet. So that's just a little bit of kind of the finances and what COVID has done to us.
And of course, these are some of the best paying jobs in some of these smaller rural communities, especially. So saving those hospitals, not only is it critical for access to healthcare, but to preserve great jobs too. So
thank you.
You know, there's been some news stories here recently about a financing opportunity that county hospitals use in Indiana to help improve their finances, and that it's really a situation, maybe you've seen it, where in your hospital probably does it, your county hospital, where they purchase nursing homes and even in adjoining counties, and that helps with the finances of the county hospital. So can you kind of explain to us that federal program and how that works?
Yeah, no, happy to. There are some complexities in the program, but there's also a lot of acronyms and other things about it that make it seem kind of maybe more complex than it needs to be. So the program that Dave describes goes by a lot of different names. The supplemental payment program for nursing homes, the upper payment limit program, the IGT program, which stands for intergovernmental transfer. But I hope I won't use those interchangeably, but sometimes they often are. But we really are talking about a specific program here that's gotten some attention and is a very important part of the healthcare delivery system here in Indiana. So hospitals, or county hospitals, all but one. I think there's one county hospital that may not partner in the program, but essentially everyone avails themselves of this, joined with the nursing homes in our state. And I want to be clear that this partnership is a very good thing for Indiana. It's been a good thing for the healthcare system. It's been a good thing for the state. And it has been labeled by some as a situation where hospitals divert money from the nursing homes. And that is just categorically wrong. That is an unfair way to categorize a program that is a true partnership, because without the hospitals, the county hospitals are the government entity that is allowed to put up the match, the dollars that are then matched by the federal government, that allow us in Indiana to have reasonable rates of reimbursement, particularly for nursing home patients. So let me back up here just a bit. This program, partnership between county hospitals and nursing homes, it relies on something called UPL, the upper payment limit. Medicare is not a great source of reimbursement for hospitals. It typically pays below the cost of care. But Medicaid almost always is well below. That's not just true in Indiana, that's true generally nationally. But in Indiana, it is true. Medicare pays a more reasonable rate, a more sustainable rate than Medicaid for hospital services and for nursing homes. The base rate, the amount that just is kind of set in Indiana rules for nursing homes and hospitals, is very low. So the difference between that becomes the UPL. It's an amount that if you can figure out a way to partner, working with the state, to essentially put a dollar kind of down on the barrelhead. Medicaid is a matching program. In Indiana, usually if we invest $1, we get $2 back from the federal government. So if the state, with all of the different competing interests in the budget, doesn't have an extra dollar to put in to raise those rates, then we've had to be creative and come up with ways to do that working together. So this program is simply one example of that. The nursing facilities themselves would not be able to do this. They're not government entities. So this idea came up well over a decade ago. It is set in federal rules. It was worked on with the state. The state has to apply for permission, basically, to the federal government. They did. We created this program. The federal government has oversight over it. They've looked at it for years and years, and it's sound policy. The program is run strictly in the manner in which it was designed here, which is the hospitals are the owners of the nursing facility. They are able to put up the dollars that then bring more money back to India. That's a good thing. If this program were to go away, and some that have kind of questioned certain aspects of it seem to not really have an alternative for how we would get really $1 billion. It's about $1 billion a year. If this nursing home hospital partnership didn't exist, we would not have it. And there's really no doubt that we would see nursing homes close. It would have a devastating impact on many of our hospitals around the state. And we think it's been a good thing and should continue.
I know last year we got an indication that the federal government was considering changing the rule here.
Mm-hmm.
Is that still in place, or is it still under consideration?
So that rule, I think even maybe yesterday or today, so it's a very timely question, was formally withdrawn. The federal government had put forth a rule called MFAR, and it was going to make all sorts of changes in the way that the Medicaid program works, the partnership between state and federal government. Again, hospitals and nursing homes and doctors and really everybody that participates in the Medicaid program that provides services to low-income citizens in their state, they've had to be creative. So we've come up with all kinds of these supplemental payment programs. And some people like to say, well, this is a loophole or something like that. No, these are all programs that have been proven to be effective, but we have to do it because Medicaid pays a low rate. And this federal rule would have jeopardized a lot of those programs. So that rule proposal was not just about the UPL program here in Indiana. It would have had impacts across the country. The federal rule that was put forth, I can't say it was a record, but I forget the number now of comments, but it had to be one of the most commented on rule ever. And you had public health agencies and hospitals all the way up to the U.S. Chamber opposed the rule because they understood how much severe negative financial impact it would have on the healthcare system. So I think that rule is likely gone, and I don't anticipate it returning.
I think it definitely would have accelerated the financial situation, the difficult financial situation with county hospitals,
Mm-hmm.
which may have even forced more of them to close or move on to a different partner. So
exactly. Well, independence. I mean, you mentioned that. That's a big part of it. There are many county hospitals, I think, that have been able to not just keep their doors open, but also remain independent. And if that's what that community wants, other communities have made different choices. You know, they've decided to partner, but for those communities, and I think there's value in having an independent healthcare entity there. This program is an important part of helping achieve that.
well, thanks. Very beneficial and educational for all of our members on that finance program. Another issue that has been in the news recently was the salaries of the CEOs of county hospitals. And as you know, counties have to um, report their public employee salaries in the newspaper, publish that, and CEO salaries are not included in that. And can you give a little bit of history of that? Because I think it wasn't too long ago where that changed.
It wasn't too long ago. It was just, I think that was 2016. But I appreciate you asking about that because I certainly am concerned with some of the ways that has been depicted. I want to state that it has nothing to do with county hospital executive salaries. It has nothing to do with the UPL program, the nursing home program. I've seen that in some news articles. These things were sort of linked together or kind of intertwined. And they had nothing to do with that. And I know, as I was at the Hospital Association, I want to say we started working on an issue in 2013. And this issue was that county hospitals exist in an environment where, yes, they're government entities, but as a hospital, they don't get direct subsidy or direct operational funding from the county. They have to compete. They have to compete in a competitive healthcare environment with other private entities. And so probably 15 years ago, there was a big effort made to kind of modernize the county hospital law. So that they could effectively compete out there. So, for example, there's certain elements of a county hospital strategic planning. Those are confidential under state statute because, again, they would be at a severe disadvantage if they didn't have that ability to retain that information. County hospitals have never had to fill out a certain form with the State Board of Accounts to list the salaries of every individual at the hospital. And that had been longstanding policy. And the State Board of Accounts, and I think it was 12 or 13, they approached some hospitals and said, hey, you have to now start using this form. And we disagreed. We felt that the statutes that protected that confidential information for county hospitals already covered that. And it wasn't controversial. It wasn't a policy issue. It was just an interpretation. It wasn't adversarial. We worked on it for a few years, back and forth. The Attorney General's office opined. And again, no one had a policy issue, but it was clear that we needed to clarify it in the statute because what was happening is that county hospitals, again, operate in this very competitive environment, and the salaries for all of their employees, and I know for public officials, I mean, within your entities, that is true. But what our hospitals were seeing was that they would spend significant amount of money and resources to recruit a physician to a community. And bringing a physician or a nurse practitioner to a rural community, it's a challenge. These are very scarce human resources. And they would come into a community and their salary would be public. And it wasn't just physician, as I said, it could be a nurse manager, other people, and they could be easily poached. That's what we heard from our members, was that the availability, which again was we thought already was not something that was public. There was an interpretation change. It created a vulnerability. So there was legislation brought forth. We supported it, and it was vetted in committee that would make that information non-public. Again, it affects all county hospital employees, but it was not about the executive salaries, not about UPL, and really there were no objections when it was brought forth in the legislation.
That's a great explanation of that. I appreciate that.
It's a lot of history. I know it's a
Yeah,
long story, but you know, there's been some things that have come out and wanted to make it so simple and make it sound like there was, but it's kind of boring why it happened, but it may seem, I don't know, a little bit more conspiratorial in sort of a different narrative.
And again, as I mentioned, our county hospitals are so critical for so many communities. They fund a lot of different programs, sports programs, recycling programs. I live in Hendricks County and Hendricks Regional. So they do a lot for the community at the high school level, grade school level, and just a great partner. So I'm sure it's like that across the state. I appreciate that.
Yeah, I mean, what the EPL program has meant to Indiana is nursing facilities have been able to hire staff, improve their facilities, to be able to put on more training and education for their workforce. It's meant a lot to nursing facilities. And again, there's some modeling out there that demonstrates that without the UPL program, we would have hundreds of facilities closed. And on the county hospital side, the UPL program, it's allowed, I know in your community, there's a countywide paramedicine program. There are fantastic things that hospitals have been able to do that would go away if we did not have this program, which has been, again, a real partnership between hospitals and nursing homes. The dollars have been shared in ways to serve patients, not diverted away from patient care. It's served Medicaid patients at the hospital side and on the nursing facility side.
Well, again, that's sort of the end of the conversation. We have a couple people online. If they have any questions, you can put something in the chat box. If you have anything, we'll give it a few seconds to see if there's any questions. If not, this is recorded, so we'll make this available to all the counties who have county hospitals so they can watch it later. We're not able to participate today.
And Dave, if I could just say, I just thank all of your members for their support of their hospitals. It's you know, when you look around the country and see many hospitals going away, you know, I'm sure you view it as an asset. Your community does as well. So thank you for all that you do to support your county hospitals.
Check the chat box. Looks like there may be a comment in there. No comments. Okay. All right. Well, good deal. If you have any questions, just email us and we'll get you the answer. But again, appreciate your watching today, and thank you for all your support of the Association of Indiana Counties.